Hello everybody, welcome to this live demonstration and Q&A with Debritom. Thank you all so much for attending and taking the time out of your busy schedules to come and join us. It's really appreciated that you're taking the time to engage with us. A massive thank you to Adrian and Debritom and Medaxis for helping us put this together. And of course, a huge thank you to Martin and to Irma for doing the demonstration and showing us this debridement, and obviously for giving us access to their clinic and being up for helping us deliver this here to you guys in the UK. So massive thank you to all three of you. So feel free to feed any questions through during the presentation. So just field them through, and as we get towards the end, we'll start to respond to some of those questions and try and answer them. And then right at the end, we'll obviously get into a live Q&A and have a discussion. The event, or the webinar, sorry, will be recorded, and we can send it out to you guys after the event. So yeah. So without further ado, I'd like to introduce Adrian. Adrian is Vice President of Sales and Marketing for Debritom over at Medaxis, and he is going to do an initial introduction and demonstration. So without any further delay, I'll hand you over to Adrian. I'll speak to you guys later. Many thanks.
Thank you, Rob, and hello to everybody. My name is Adrian Zweifel, VP of Sales and Marketing with Medaxis, a Swiss company. You got lucky today. Since Rob introduced me already, I can make a long story short. I've been working within the medical device industry for almost 20 years, whereof 6 years with Medaxis. Today, I talk briefly about quick, efficient, and easy debridement with our micro-water jet device, Debritom Plus. We launched our first generation micro-water jet device, Debritom, in 2000. Basically, a miniature power washer for wound debridement. Back then, there was one standard jet nozzle available. A handpiece was multi-use. Cleaning of the device was extremely cumbersome and very time-consuming, and the cost of the device was almost £30,000. Starting the development of the second generation micro-water jet device in 2014, Debritom Plus was launched 4 years later in 2018, in Switzerland at first. Its handling extremely simple, more flexible, with different jet shapes, and just a fraction of its predecessor's price tag. In parallel, Dr. Reber and Dr. Nussbaumer performed a retrospective clinical application observation, analyzing 90 patients treated within a 3-year time period. The results, published in 2018 Wound Medicine, was astonishing. A reduction of healing time compared to traditional methods of almost 30% could be shown. Medaxis' plans are to entering the European and the US market. In the US, a randomized controlled study, multi-center, will be starting in September this year, enrolling 120 patients until the end of 2021. Guess that was enough on stats. Let's get down to the bare bone now. First of all, I want you to get familiar with Debritom Plus components. The pump, generating the needed pressure levels, the handpiece, available in 3 different jet shapes, and the connecting tube to connect the sterile solution with the pump. On this side, we have got 2 products that protect the surrounded area from the aerosols, the jellyfish and the new debris clip, available coming fall. Now you know all the components of Debritom Plus, I will guide you real quick through the setup. Insert the pump first. Push it to the end and then turn it until you hear the click. Second is attach the handpiece. Screw it to the pump and put it into this secure position up here. Then you prepare your sterile solution. with the connecting tube, insert it into the solution, open the vent, clamp, and hook it up to the device. Then attach the connecting tube to the pump. That's basically it. Close the door of the trolley, turn the device on, and now you see it should start on 4. If you want to change intensity levels, you can either use the minus, go down, or the plus to go up to max 5. That's it. Now you unclamp the connecting tube, and you're basically ready to debride with the foot on-off pedal, Bluetooth operated. And here you see, it's already working. Thank you for still being with us. By now I think you got a pretty good impression about what Debritom Plus is. You shall see the microwatt jet debridement in action now, live at the Kantonsspital Obwalden in Switzerland, together with Irma. Our patient today is male, 81 years old. In his early childhood, he underwent several cancer surgeries at his lower left leg without success. Followed by experimental radiation therapy for 2 years, the cancer has been cured. The patient was then able to do various sports activities, up until 2003. A little over 50 years later, sudden pain led to further surgical removal of muscle parts accompanied by wound healing challenges for 3 years until closure in 2006. 2016, renewed surgical removal of muscle. Wound closure was at 50% at the arrival at the Kantonsspital Obwalden in March 2020. Dr. Reber prescribed biweekly wound debridement with Debritom Plus to remove biofilm and necrosis, including VAC treatments. In general, practitioner, patient and surrounding area are protected from the aerosols by a protective cover. Irma does work without in this case for better camera visibility. The gentleness of the wiping motions, the angle and the distance to the wound allow further refinement of the degree of wound debridement applied. Alternatively, the intensity level setting on Debritom Plus can be adjusted, usually done before the treatment starts. As you can see right now, the abrasion is completely in the physician's control, the debris is being removed and wanted microbleeding occurs. The fine water jet preserves the freshly granulated and healthy tissue and also stimulates the wound bed due to the massaging effect of the water pressure. Patients usually tell us that they feel less pain during the treatment and that the water has a cooling and cleanliness effect. A surgeon recently stated that it took him quite a while to learn the handling with a scalpel, but as soon as he started the microwatt jet debridement, he developed the skills on how to use the miniature power washer during his first treatment. All right, let's head over to the Q&A session, guys. The team has extensive experience with Debritom. They started with the first generation in 2012, with Debritom Plus in 2018. Martin Reber is general surgeon and visceral surgery surgeon, and he's head of the surgery. Irma Britschke, she is a certified wound specialist and is heading up the wound team in the Kantonsspital Obwalden. I'm leading over to Rob now for the questions they got asked during the session. Rob?
Okay, brilliant. Thanks, Adrian. So yeah, I'll just run through a few of the questions then. So is it possible that you could just sort of help us understand how different Debritom is to VersaJet, and sort of, you know, what the key differences are really, because that question comes up a lot in the UK. what, is it an equivalent to VersaJet?
Well, I guess this is a question I can answer. VersaJet is an OR-based device, more or less OR-based, I'd say. The water jet is horizontally applied. It's more acting like a knife. So you can dig deep and you cut the whole surface off layer by layer, where our system is very selective. It's more like a miniature power washer. Whoever has used a power washer on a deck or so in the backyard, whatever to do, know that you need an angle, you need to get underneath something to remove it. So VersaJet again is like a knife acting horizontally. We are working in an angle more selectively, I'd say.
So that leads to my next question. The question was asked about tissue preservation, and how does Debritom work more effectively than something like how VersaJet does it, for example?
I think it's so effectively because you can navigate the water jet directly on the wound site you want to debride. I can layer for layer debride or remove what I want, and then I can stop when a small or a fine bleeding starts on the wound. Then I have all material away I want to have. And I can every time have an assess on the wound. I can stop when I should be too deep in the wound. It's very precisely instrument.
Oh, okay, yes, yeah, so you've got really good control over the process, and that's also affected by the angle and the distance of the jet as well.
Yes, so I can operate with the angle and the distance, and yes, this is the benefit of this equipment.
Brilliant. One of the other questions that was asked as well is that what other types of debridement do you use? And obviously Debritom is part of the process. So what other debridement tools do you use?
We work with the scalpel and the Rincaret. Those are the other two things we use.
Oh, okay. So Debritom or sharp debridement.
Yes.
Brilliant. Thank you. And obviously, you gave us that great demonstration with the patient. How long does a treatment typically last, do you find, using Debritom?
Mostly it takes around 5 minutes, so it depends how big the wound is. At max 15 minutes, I would say. For larger ones, around the whole leg, but mostly 5 minutes. Okay, so
it's a pretty quick procedure.
Yes.
And with Debritom, and the sort of one of the questions was about how do you handle the spray, and obviously that's quite pertinent in the current climate with COVID-19. How do you handle the spray and sort of keeping the area clean? And obviously we saw, obviously you can use the dome, etc. So can you explain that, please?
Sure. You've seen Irma debriding, the live debridement. She was using a gauze, but normally she uses the jellyfish that it's covering the whole wound and encapsulates basically the aerosols. Underneath the patient's extremity, you put an absorbent towel so that the water is going to be collected there. Again, there's not much water used during procedures. I'd say 200 milliliters up to 300, 400 max. That's already a lot. We're coming out with a new device, a Debri Clip, which is much smaller and extremely versatile for smaller wounds.
Okay, brilliant. Thanks, Adrian. So, can I ask then, why do you choose to use Debritom above, any other device? What is it that makes you, as clinicians, use it?
I think it's a very simple device for using, because you make an installation in the morning and then you go to the patients and you have only changed the handpiece by every patient. It's a mobile device. You can go everywhere in every room. You are very quick in another place, and it's immediately ready to use. And the effectively I told about, and it's very comfortable for the patients. In the most cases, they have no or only a very little pain by the debridement.
And it's also very easy to use it bedside. Just bring the device in the room and just use it. So it's very easy.
So one of the questions that got asked actually was about pain management. You said it's obviously normal, it's very comfortable for the patient. So you can just bring it to the ward, to the bedside. Is there any sort of preparation you have to do with pain management normally, or is it just really quite simple? You just turn up and go?
Yeah. Yes.
Right. Yeah. So the patient just finds it comfortable. It's, you know, typically the patients are okay.
And it's also in the summertime, or mostly the wounds it's getting cool, and it's a cooling feeling on the leg or on the wound side. It's comfortable for the patients. Yes.
Oh, yeah. Okay. Yes.
Washing. Yeah.
You often get some relief from it. Oh, brilliant. And how would you say it's helped your practice and your clinic using Debritom? What's improved as a result of using Debritom?
I mean, it's comfortable for the patient. It's very effectiveness, and it gives the wound a better chance to heal. Like just remove all the scrub and all the old stuff, and yeah, like we said before.
Yeah. So is it fair to say that, you know, has it speeded up the process any? Has it made it more quicker, more efficient for you to do your debridement? And yeah. Okay, brilliant. Thank you. Well, that was all of the questions that have been asked. That you know, so thank you for taking the time to answer those questions. It's much appreciated. I think we've covered all of the questions that came up. So yeah, perfect. Did you any comments, Adrian?
No, I think we're good from my end. Thank you all the attendees for being with us the whole time, the last almost 30 minutes. Thanks a lot. Much appreciated from our end.
Yeah, and the same from all of us at Regen. And thank you so much for taking the time out of your busy schedules to come and give us the demonstration and answer these questions. It's greatly appreciated. Thank you.
Thank you.
Thank you.
All right, brilliant. Thank you.
Thanks, everyone.
Thank you.